Hi, my name is Dr. Jennifer Kolb, and I'm a longtime PA, fierce healthcare advocate, and the current Chief Medical Officer of the American Academy of Physician Associates. So let's talk about something we hear all the time as PAs. America has a provider shortage, but the truth is a little bit more complicated. It's not just a shortage problem, it's a utilization problem. Too often, PAs are held back by outdated clinical practice requirements from laws and regulations written back in the 1970s to internal policies and bylaws with little evidence to support them. These rules add cost without adding safety, and they block patients from getting timely care. One of the most straightforward solutions is simple. Modernize PA practice by removing outdated barriers that unnecessarily restrict PAs, health systems, and their patients. The research is clear. A 2019 MedPAC report recognized a large body of evidence, clinical trials, retrospective studies, claims data, and surveys, all showing that care provided by PAs produces health outcomes similar or equivalent to physician care. But the benefits extend beyond outcomes. States with modern PA practice laws see fewer preventable deaths, even greater than gains achieved through Medicaid expansion. And those states also see better appointment availability, especially in rural and low-income areas where access is most strained. Between 2017 and 2022, patient encounters with PAs and NPs grew by nearly 50%, while physician encounters declined by 16%. This shift shows that as physician capacity contracts, PAs are increasingly stepping in to meet the demand for care. From a productivity standpoint, PAs on average generate 3 to 4 times their salary and revenue. Additionally, those clinics that added PAs saw an increase in physician productivity, including case complexity and surgical encounters. This is why PAs, the AAPA, patients, and healthcare organizations across this country need to be united in one clear message. It is time to remove outdated and arbitrary legal requirements that force PAs to be tied to physicians. This reform gives employers flexibility to design smarter care teams that better reflect how care is delivered today. These teams must reflect today's needs, not yesterday's rules. Because when we eliminate these unnecessary barriers, we unlock better care for everyone. We've already seen what's possible. During the COVID-19 pandemic, 13 states lifted these arbitrary restrictions through emergency executive orders. Suddenly, PAs could be deployed quickly to ICUs, ERs, and community clinics. The result? Expanded access and many patient lives saved. Let me share part of my story. During the pandemic, I was part of an executive leadership team at a large academic hospital in Chicago, charged with coordinating care across the entire health system. One of my many roles during that crisis was that I was in charge of the provider redeployment team. My job was to make sure that we had the right physicians, PAs, and nurse practitioners in all the right places to take care of not only the large influx of critically ill patients, but also all of the other patients that still needed care. Time and time again, I was asked if we had a PA that could do that. And with the governor's removal of those arbitrary restrictions, I was able to put PAs where their skill set and their expertise was needed most, with the patients. Stay tuned because in the next video, we'll explore why the underutilization of PAs must change in the coming decade.